Suzanne, welcome to the show.
Hi, thank you for having me.
So this is still in the early stages. You're in the signature gathering process to just get this on the ballot. How is that going right now?
So we just got our title and summary last Friday, and so we will actually be hitting the streets collecting signatures in about a week. So we haven't quite started, but we know there's lots of excitement about the petition, and so we think it's going to go well once we're out on the street collecting signatures.
With this proposal, how much money do you expect the state's government could collect, and how exactly would that money be used?
Yeah, so the California billionaire tax is a one-time emergency 5% tax that is taxed on only 200 or just over 200 individuals here in California, and it would raise about $100 billion over 5 years. 90% of it would go to healthcare, 10% of it would go to K through 14 education and food assistance programs.
For the last couple of weeks on social media, we've seen a lot of debate on this. The New York Times reported that venture capitalist and co-founder of Google, Larry Page, as well as venture capitalist Peter Thiel, are seriously considering leaving the state. What's your response to that?
You know, there are always these kind of chicken little arguments whenever there are tax policies like this being proposed. And when we look at real life examples of these kind of tax policies, none of that ever materializes. So as an example, in Massachusetts, they moved a millionaire's tax. And there were lots of kind of rumors and speculations that millionaires were going to flee the state. And when the tax passed, it actually was the opposite. And so now there are more millionaires in the state of Massachusetts. And so I just think kind of the swirl that is happening right now around the California billionaire tax is kind of the same argument. And we really believe that the benefit from this tax is going to outweigh, maybe a couple people moving out of the state, because we're really heading towards a healthcare crisis where we are going to see billions of dollars cut from our healthcare system. And the money raised in this initiative is going to support that.
But California already has one of the largest budgets in the nation, and we already have a progressive tax system in this state. People like Page and Thiel and the other top 1% of earners in California combined pay about a total of half of the state's income tax, which pays for state programs. I mean, why risk losing those people?
So the way that the billionaire tax is actually written is it is to deal with cuts that are coming from HR 1. And so really what we're talking about right now is, as we're heading into 2026 and with the passage of HR 1, the state of California is looking at losing $100 billion in healthcare funding for the next 5 years. And if we don't do anything right now, we are going to see our hospitals close. We are going to see ERs close. And so that's really what this billionaire tax is about. And when you also look at ultra wealthy folks, they are not taxed similar to like teachers and firefighters and, everyday workers that have to pay on their income tax. They actually don't get taxed at the same rate as many of us. And so we actually think that the revenue that's going to be raised from the billionaire tax is going to outweigh any loss in terms of, if any of those ultra wealthy folks move out of the state.
Some of those ultra-wealthy folks, venture capitalists online, including David Sachs and Chamath Palihapitiya, have basically said state leaders can't be trusted, though, with even more money, pointing to some of the fraud and waste in our state budget. I mean, is that a fair point that they're making?
The initiative is actually written in a way so that the money can only be used. It's put in a special fund. It could only be used for 90% of it has to go towards healthcare and specifically services that were cut through HR 1. And so that means Medicaid. That also means subsidies for covered California or folks that are on the exchange. It also includes, services like home care services, nursing home services that seniors and veterans rely on. So this initiative is written in a way that the funding or the revenue that is raised can only go to these cuts that we've been talking about.
I guess my question, though, is do you fully trust California's leaders right now with some of the track records in place on some of these programs that have resulted in waste or fraud? I mean, do you fully trust them to be able to carry out what you're asking them to do in this ballot initiative?
So, I trust that the way that we've written the initiative is going to ensure that the legislature and those that are making decisions around funding are going to move funding towards the programs that have been cut. That's exactly what the money has to be used for. And so we will ensure that that happens.
It's not just billionaires who are fighting this proposal. Governor Gavin Newsom is also. This has been a non-starter for him when proposed at the state capitol over the last couple of years. And shortly after you filed this, he launched a formal campaign to fight this proposal. What's been your response to that?
You know, we think as the governor and others start seeing the effects of the cuts that are coming from HR 1, we're already seeing premiums go up. We've seen many stories in the past couple of months of individuals, in shock with the amount that their premiums have gone up. And as we start seeing hospitals, we just heard of a hospital in Alameda that they're laying off folks because they know the cuts that are coming their way from HR 1 is going to impact their workforce. And so as all of these outcomes from these cuts happen, we believe that the governor is going to reconsider his position.
Have you had any conversations with representatives, state senators, any lawmakers about this specific proposal before trying to get it on the ballot?
Not before, but I will say as we've been building the coalition, we're talking to legislators, other politicians all across the state to, garner support. And so we're excited to announce those, in the coming weeks.
California's budget has grown from $208 billion to $322 billion over the last 7 years. Do you really think that more money means more effective government?
What we're talking about right now is California is heading towards a healthcare collapse. As I said, hospitals are going to close. We're already seeing layoffs start. We're going to start seeing ERs with longer wait times. We're going to see seniors and veterans lose services. That's what this initiative is about. We have to make sure that we're bolstering and we're securing the healthcare system that we have right now. And so that's really what this initiative is about.
For those who may not be familiar with the ballot initiative process, you could get this on the ballot and then go to state lawmakers and the governor and try to negotiate it off. Is that a possible end game here, is to get them to come to the table on some sort of funding? Or do you truly want to present this to voters in 2026?
Yeah, the goal here is to put this on the ballot in the November ballot. We believe that voters are going to support this. So our goal here is to put this on the ballot, let voters decide. We believe that voters are going to understand the dire need in securing or bolstering our healthcare system.
All right, Suzanne Jimenez, we really appreciate your time. Thank you.
Yeah, appreciate you having me. Thank you.